First of all, I want to thank you for the opportunity, Dr. Butler, to share with you and your registrants this morning. I need to thank my law firm, Rubenstein Law, that supports my public service and allows me to fight for people from the courthouse to the Capitol House in Tallahassee. 1-800-FL-LEGAL, that's my commercial for all of your personal injury needs. My topic this morning is the political is personal and policies that impact healing while Black. I want to thank all of the sponsors and the partners and the collaborators for this powerful summit. And Dr. Kenton Butler was amazing. Most of all, thank you to the registrants and the participants and the providers of mental health services. You are the most important people in this room. I'm grateful for you warriors on the front line, helping the users and abusers, helping those with mental challenges recover and heal, helping to stomp the heck out of stigma. Thank you. In a few minutes, allow me to humbly share so that you understand the political is personal. See, I haven't always been a state senator, elected by the constituents, people of Tampa and St. Petersburg to represent them in the Florida Senate. This has been the second highest honor in my life. The first highest honor has been healing. It's been recovery. It's what I learned as a daily reprieve. I can't be who I am or what I am without recovery, without healing. I can never forget the moment that my real journey to healing began. I'll never forget the feeling of loneliness, of hopelessness, of rage, the gift of desperation. Reaching the bottom was my gift of desperation. I became desperate to change. And whether I believed I could or whether I believed I couldn't, I knew I was right. After 15 years of smoking crack, snorting cocaine, drinking alcohol to excess, self-medicating, I accepted your help because you believed in me, because you saw that I could heal, because you helped me get over shame, stigma, and introduced me to a set of principles designed so simply that anyone could follow them. I've been taking this journey to wellness for 22 years, 4 months, and 2 weeks today. This personal journey has not been without challenge, but each one of us brings the sum total of all of our experiences, both good and bad, to our professional, or in my case, to our political lives. The political is personal. In fact, I was challenged by leaders in our community to run for political office after I finished 2.5 terms as president of the NAACP in St. Petersburg. Some said, man, you gotta be crazy. You going into politics, a former addict, a former alcoholic. But the question that I asked was, but I'm walking my sobriety and clean time with integrity. So why not me? And in the first debate, when I ran for state representative at the St. Petersburg Yacht Club, my opponent stood up and he said, ladies and gentlemen, I've served you well for 7 years on the city council of St. Petersburg. But before I tell you about me and no blemishes on my record, let me tell you about Darryl Rouson. He's a drug addict. He's been arrested 2 times for DUI. He's this, he's that. You know how people will sometimes read your inventory instead of taking account of their own? Well, when it was my turn to get up, I looked at the audience and I said, ladies and gentlemen, everything my opponent said about me is true. It is absolutely true. I said, but this is a special election. And it's not special just because the governor has elevated the seat holder to a new position, vacating the seat, calling for a special election. That's not what makes it special. What makes it special is the election is March 25th, 2008. And for those of you who are believers, that's 2 days after Easter Sunday. So we are campaigning, we're politicking, we're running through the season of Lent, the season of redemption, the season of resurrection that leads to new life. How dare a man stand up and suggest that another man can't become something because of what he used to be? And I went on to win that election and serve for 8 years in the Representatives. Then I ran for the Senate. They said I couldn't win. But I'd already kicked drugs. I had already kicked alcohol. I'd already reached a point of wellness in my journey to healing. And so I ran and was elected senator. And I'm the go-to senator in the state of Florida when it comes to substance use disorder and mental health. The politics is personal. As an example, they teach us in the program of recovery that the therapeutic value of one addict helping another is without parallel. Without parallel, the therapeutic value of one addict helping another. And I know this in my own life. And so 2 years ago, I filed a bill that would have allowed and expanded hugely the opportunity for peers, peer specialists to work in the field. It forced a debate, it forced a vote, and a narrower vision passed, but I'm intent on working on that and expanding the pool so that those who do recover, with your help, can work in the field and help others. Secondly, I filed a mental health parity bill. Currently, under federal law, an insurance company is required to treat a mental health issue the same as it would a physical medical issue. That's not happening in practice in Florida. And I want to bring parity to that issue in Florida. I've been unable to push a debate, but I've created awareness, and we're going to come back at that next year. In many instances, we were seeing people checking in for addiction treatment only to be denied coverage, or if coverage was initially offered, it was clawed back at a later date. And we think that's unfair. So we're going to come back at that. The political is personal. In summer of 2018, I traveled the entire state of Florida, put 5,000 miles on my car. I visited 43 drug treatment facilities, halfway houses, sober homes, emergency rooms of hospitals, talking to clients, talking to counselors, talking to administrators. And based upon the evidence that I gathered after hearing and listening what was happening in the field, I was able to get a $3.5 million appropriation added to the budget, and I entitled it Road to Recovery. And it's going to do care coordination. But this is a Healing While Black Summit. And I cannot conclude my remarks without mentioning, without underscoring, without affirming cultural issues in recovery. I've had my own personal experiences that caused me huge trust issues early in my recovery. Some of you may have heard of Turning Point of Minneapolis, one of the few culturally specific treatment facilities in the country. I spent 4 months there after I rejected traditional treatment because I didn't trust. I wouldn't open up. I wouldn't share. I didn't feel that they were sensitive, the counselors, or they were listening, or that they truly cared about the double whammy, being Black and recovering. This pandemic is causing heightened awareness in communities of color. You know the old saying, when white folks catch a cold, black folks catch the flu. This pandemic is ripping the wound, the scab off the wound, and exposing things for what they've been. Now, why do I say that? I say that because Black folks are less likely to have access to treatment facilities. And if it's accessible, they're less likely to use it. And it's incumbent upon us to ask the tough questions, to listen to the responses, and hear the solutions. In the year 2000, the Florida legislature created the Office of Minority Health. And it's ironic that they created it based upon the fact that they believed there were disproportionate healthcare outcomes in communities of color because of underlying morbidities like diabetes, like asthma, like hypertension, like high blood pressure, like sickle cell disease. They believed that they needed to beef up access and beef up quality of care to communities of color. And it started off with a $10 million budget. Over the years, it dwindled down. They lost full-time positions and the appropriations dwindled down to $3 million. Yet this pandemic is teaching us that we need to pay more attention to minority health concerns, particularly this month when we celebrate Black and Indigenous people of color opportunities. This is the perfect storm. With the racial tensions flaring, with loss of job, and then if you lost your job, inability to access unemployment benefits, loss of health care, death all around us, uncertainties, anxieties that lead to relapse, overdose, and trauma, psychological trauma that might lead to physical health. We just need to do something better. And one of the things I'm working on when I get back to Tallahassee, when the legislature picks back up, is to double that budget for minority health and create answers and solutions. So what can you do? You can struggle together during this summit. What can you do? You can collaborate on identifying solutions. You can communicate these solutions to policymakers, to lawmakers such as myself. Confront your legislators with real-time data, with what's really happening in your communities to Black folks seeking healing in recovery. Work together. And in conclusion, I want to say that this is the greatest opportunity that we have had in a long time to change the narrative, to listen, to hear, and to act on it. Thank you.
Thank you so much, Senator Rouson, for your commitment to equity during this time and all the work that you're doing to ensure that we can heal while being Black. Next, we will have an opportunity to hear from our next speaker and her work. Thank you so much, Senator.